Good morning, everyone, and welcome to today's Health Chats on Men's Health. Thank you so much for joining us this morning. My name is Katie Mitchell, and I'm a part of the communications team here at United Ag. Before we get started, I would like to recognize our sponsors who make all of our programming possible: CVS Caremark, Elite Medical, HCP National, Plantel Nurseries, and Sayin. Thank you. Please be sure to chat in any questions you have along the way via the questions feature on the right-hand side of your screen, and we'll answer them at the end of this presentation. We are recording this presentation and it will be available for viewing, right after the webinar ends. Now I pass it off to our Chief Medical Officer, Dr. Rosemary Koo.
Thanks so much, Katie. It's a pleasure to be here today to talk about men's health. I think this is an area that definitely needs more awareness. We talk a lot about different health disparities that affect certain racial populations, or we talk about, women's health outcomes being not on par with men. But in fact, there are many areas in which men's health can be improved. And so we're going to be talking about those areas for improvement and what we can do to make sure that men can have optimal health as well. And so today we're going to be reviewing the leading causes of death for men. I'm going to talk about men's health disparities. We'll go over the key health screenings that all men should be getting. And lastly, we'll talk about tips for health optimization. I'll have about 10 minutes of content today, and we'll leave plenty of time for Q&A at the end in case there are any questions. So first off, here are the top 3 leading causes of death for men today. The first is still heart disease. This has been the leading killer of men for many decades, actually, for recent times. The second is actually cancer, and the leading cancers in men are still prostate, lung, and colorectal cancer. There's plenty of room for improvement in those areas. And then lastly is an unintentional injury or accidents is the third leading cause of death for men. And so I think the bright spot here is that all of these are highly preventable. Well, and we're on the next slide, we'll talk about kind of the health disparities that lead to these being the top 3 leading causes of death for men and what to do about them. So first of all, men generally do have higher blood pressure than women, but it's really staggering that more than half of men over 20 years old have clinically diagnosable hypertension. So they don't just have high blood pressure once in a while. They actually have a chronic disease of hypertension, and the majority of them don't know about it. So if you have 2 men in your room, say take your dad and your uncle, one of them has hypertension. And that's really impressive. And we need more men to get screened for their blood pressure, because the thing is that most people with high blood pressure don't know they have it because it doesn't come with symptoms until it's very severe. And that's why high blood pressure is called the silent killer. And certainly a lot of people, men, women, and almost everyone these days are hesitant to seek out healthcare unless there are symptoms. So unfortunately, a lot of chronic conditions like hypertension that don't have symptoms often go undiagnosed. And during that time that they're being undiagnosed, that means they're untreated and therefore causing a lot of health issues that could have been prevented. So obviously the high blood pressure ties into the heart disease risk that men are dying from. In the same category as cardiovascular risk is also cholesterol levels. Men tend to have less of the good cholesterol, or HDL, than women, and they also can have higher LDL cholesterol too, which is the bad cholesterol. And also, there's a misconception that it's just overweight or obese people who have these cardiovascular risk factors. However, there are many men who are kind of in the normal weight range that have elevated cholesterol or have hypertension and don't know it because they don't think they physically look like someone who has those diseases. And given the high prevalence of these chronic conditions, it's really important for everyone to be screened, whether or not you personally think you're at risk, because you might actually be genetically at risk. A lot of these conditions do run in families, so if you have any family members with chronic conditions such as hypertension or diabetes, high cholesterol, or heart disease, it's definitely worthwhile to get screened for them. Secondly, men actually have increased use of substances, including alcohol and tobacco. During in a prior health chats, we talked a lot about tobacco. So you've heard me talk a lot about all the chemicals, the thousands of chemicals in tobacco. Hundreds of them are known to be toxic. And those chemicals not only lead to cancer, but also to erectile dysfunction and infertility because those chemicals can actually directly damage DNA. In addition, the majority of deaths from excessive drinking actually happen in men. This is very unfortunate, and they are twice as likely to binge drink than women. And this is why we see certain cancers that are actually more common in men, such as the mouth, esophagus, liver, colon, and pancreas cancers. Unfortunately, men see more of than the rest of the population. And then lastly, I know we've been talking a lot about mental health. Even prior to the pandemic, men have had worse outcomes in mental health. And so it's incredibly important that we raise awareness of about this. This is actually a statistic from prior to the pandemic, and it might actually be worse now, is that there's a 4 times higher risk of suicide in men compared to the rest of the population. And in fact, 4 out of 5 suicides in the US are actually in men. And these risks are actually higher for those who are gay or bisexual. So this is a very important area in which getting appropriate mental health care can save a lot of lives. In addition, poor mental health can lead to the unintentional injuries or accidents that lead to death as well. So this is an incredibly important and unaddressed area in our population. And as I mentioned earlier, that there are a lot of conditions that are important to be screened for because you might not have symptoms. We've already talked at length about blood pressure, but I also do want to mention lung cancer. For those adults who are 50 to 80 years old, and if you have a significant smoking history, you actually might be eligible for a lung cancer screening. And since men are more likely to use tobacco than women, this is a really important area in which we can prevent some of that late stage lung cancer that is so deadly in men. Third is colorectal cancer. Now, everyone needs colorectal cancer starting at age 50. This is not necessarily specific to men, but it's really important to remind us here. Colorectal cancer screening can happen in a bunch of different ways. It doesn't always have to be a colonoscopy. Colonoscopies do occur every 10 years, but there are actually other screening methods that don't require sedation, and they don't require kind of having a procedure and taking that much time off for a colonoscopy. Even something like an annual stool test is actually very easy that you can do basically at home and send in the sample to your healthcare provider. So there are a bunch of different ways in which colorectal cancer can be screened for. Again, this is for the general population and not specifically just men, but it's really important to recognize. And then lastly, there's a lot of controversy over prostate and testicular cancer screening in men. I just want to clarify what the recommendations are. The prostate cancer screening has evolved quite a bit over the years. Many years ago, it was recommended that all men get a blood test screening through PSA and or digital rectal screening for prostate cancer to make sure that there are no masses or tumors that could be felt. This has really fallen out of favor. And at this point in time, there is no general screening recommended for everyone for prostate cancer. The reason why is that tumors were detected, but they might not have been cancerous. Or if they were cancerous, they might not have been lethal. And so a lot of men were having surgical procedures of biopsies and surgeries to take care of these growths. But then the consequences of those surgeries basically outweighed any benefits to prolonging life. And so that's why we don't typically recommend prostate cancer screening across the board for everyone. However, this is an individual decision though. So please talk with your doctor. Mention your family history. If you have any family history of any types of cancers, that's really important for your doctor to know about. If you have any chronic conditions yourself or have used any substances regularly, that's important to talk to your doctor about as well, because that changes the way they think about your personal cancer risk. And so prostate cancer screening is still available, but it's really more on an individual basis and really more optional depending on your personal preferences. And it's not something that everyone has to do. And then lastly, on testicular cancer screening, for men who have no symptoms at all, who are feeling well, have not detected any growths or anything like that in the testes, there is no generalized recommended screening for testicular cancer. And then here we'll talk about the most important tips to maximize a good health. The first I've talked about quite a bit is avoiding alcohol and tobacco. I do want to focus a bit more on the second item here, which is consistent, good quality sleep. I think sleep is often thought of as a nice to have and almost kind of like an afterthought that, oh, it's great if you got a good night's sleep, but maybe that's pretty rare. And most of the times we generally live in a more sleep deprived state. And adults typically need at least 7 to 9 hours of sleep. Some might need more on the spectrum, or some might need actually closer to the 7 hours. But the 7 hours is kind of generally thought of as the minimum, and many Americans do not get this minimum duration of sleep, or the sleep quality might not be very good. But the reason why sleep is especially important for men's health is one, it actually contributes to better mental health, which we've talked about. And so it can actually reduce suicidal ideation. Good sleep can also reduce anxiety and depression as well. So first off, sleep is critically important for our brain functioning and mental health. And then second, specifically for men, sleep is the time when the body releases the majority of its testosterone. And studies have shown that 1 week of sleep deprivation, that means getting 5 hours or less of sleep, in as little as 1 week, can reduce testosterone levels by 15%. That's a lot. Normal aging actually only decreases testosterone 1 to 2% per year. And so if you think about it, if 1 week of sleep deprivation can decrease your testosterone levels by 15%, that is not getting good quality sleep is really a huge detriment to one's health, and especially for men's hormonal functioning. Third, it's really important to seek mental health support early and often, and to not wait for crisis situations, and also to not rely on coping with substances such as alcohol when we are not feeling 100% in the mental health arena. And then lastly, all men should be getting their annual wellness visit. I know typically in our membership, men are a little bit less good about getting their annual physical, but during an annual physical, everyone gets screened for things like blood pressure, they get their weight checked. Regular screening labs are recommended so that we can check cholesterol levels, rule out diabetes, and also during the annual wellness visit, your personal and your family medical history is reviewed so that you get you get a personalized plan for what you need to do for cancer screenings as well. And so getting all of that done at an annual visit is easy, it's quick, and it's something that could not only save your life, but also save a lot of time and cost later on in case you develop a condition that could have been prevented. So these are kind of my my top tips for optimizing good health for men. We have plenty of resources. Oh, excuse me here. We have plenty of resources at United Ag to help with these health optimization tips and also health screenings. First and foremost is that if you haven't had your annual wellness visit, please call our health and wellness centers. So that you can get booked. If you're not a patient of our health and wellness centers, you can still call. If you would rather see your own provider that you have a relationship with, that's fine. But if you haven't seen your doctor in a year, please go ahead and schedule your annual visit. At our health and wellness centers, we also have our lifestyle coaching program, which can address chronic disease risks such as prediabetes, diabetes, and of course, hypertension that affects more than 1 out of 2 men. And then we also have Teladoc available to discuss any symptoms you might be having and that they can get you into care as soon as possible. So with that, we'll open up the floor to questions.
Thanks, Dr. Koo. Again, there is a questions feature on the right-hand side of the screen, so you can go ahead and submit your questions there. In the meantime, while we're waiting for those questions, I just wanted to let you all know that next month's health topic is on lifestyle coaching, which will be at 10 a.m. on July 15th. We hope to see you all there, and a registration button should be popping up on your screen now. Okay, so it looks like we have a couple of questions. So if you do not have a family history, would it still be okay to let your doctor know this? How would you go about requesting tests?
I'm not sure if that question was directly related to general health screening or specifically cancer screening, but I think in general, it's really important to talk to your doctor about the conditions that you're concerned about. And that way they can give you advice on whether or not you are at risk, what you can do to check to see if you are at risk in terms of screening, and then what you can do to minimize any of those risks that are found.
Thank you. Okay, we have another question. A lot of my male employees have come in and asked how they can get more sleep. A lot of them are severely sleep deprived, and I can see the depression. Do you have any suggestions for my employees?
Yes. So there's a very common reason why a lot of us don't sleep well, and that's actually obstructive sleep apnea. And so for anyone, men, women, everyone, if you know that you snore, if someone's told you that you snore loudly, or you're still tired during the day despite getting a good amount of sleep, you might actually need to be screened for sleep apnea, which causes you to stop breathing multiple times in the night, and that really impairs sleep. So I actually recommend sleep apnea screening across the board for anyone with fatigue or feeling like they're not getting good sleep. As far as maximizing the duration of sleep, because a lot of us have trouble actually even just making enough time for sleep. I always tell people if you're shooting for 7 hours of sleep, you actually have to try to allocate 9 hours, because it does take quite a bit of time to wind down from our work and electronics, to help our bodies kind of get ready for sleep. And so even blocking out that time to make sure that there are no distractions or conflicts with making sure you can get enough sleep is really important to prioritize. Electronic use at night can often keep people up late. It can also impair sleep as well because of the blue light emissions from our electronic devices. So having a time after which you put down the phone, don't be on your computer afterwards is really quite important too. And then lastly, is avoiding evening alcohol. I know a lot of people like nightcaps, and it can seem to be relaxing, but it can actually keep people from getting the deep sleep that they really need for their brains.
Great. Thank you, Dr. Koo. We have another question. Is there a specific age range where men should begin asking their doctors about getting these health screenings?
Yes, any adult should be asking about these. Given the prevalence in our country today with chronic conditions, actually 60% of adults in the US have at least one chronic condition. Given that high percentage and high risk factor in our nation, I think it's really important for all adults, no matter how young, like even starting in the 20s, to actually talk to their doctors about these issues.
Okay, we have another question here. Is there an amount of alcohol consumption that should not impact your health?
That's a really great question. The standard recommendation is that men should not go above about 2 drinks a day, and that women should not go above 1 drink per day on average. That doesn't mean that you need to have 1 or 2 drinks a day, but that's just kind of the upper level of what we recommend as safe. I do think it's really important to be mindful of why we consume alcohol. So if we're doing it to cope, that's probably not the healthiest way to deal with what we're going through. And perhaps we can find some more productive ways of managing instead of going to alcohol. If we're celebrating with friends, or having a glass of wine with dinner, on occasions, that is perfectly fine and should not have any long-term detrimental effects to our health.
If anyone has any additional questions, please submit them on the right-hand side of the screen. Okay, great. I think that's all the questions that we have for today. Thank you so much for presenting today, Dr. Koo. This was a great health chats.
Thank you so much, Katie, and thank you to everyone for joining us this morning.
Just as a reminder, this is recorded and will be shared right after. Please remember to share health chats with your friends, your families, and your colleagues. Have a great week, everyone.